Good morning, everybody. And thank you for joining us for the first presentation of the day. My name is Robert Call. I'm the founder and CEO of CloudDX. CloudDX is actually short for Cloud Diagnostics, which pretty much describes what we do. And so we're very excited to be able to present today, and hopefully we're live streaming this and also recording it. And so let me tell you about CloudDX. Just pause for a moment and mention there will be some forward-looking statements. And this is on our website, so if you want to read this, you can. What I want to share with you this morning is a pretty exciting story. CloudDX has really got three major claims to fame. We've been in business now since 2014, so a little over 8 years. And the three big things we're going to talk about today are partnerships. We are partners with some of the largest medical technology companies and telehealth companies in the world. Rapid growth. Telehealth, and especially the part of telehealth we specialize in, which is remote patient monitoring, is growing very, very quickly, driven by the pandemic, but now in the post-pandemic world, really picking up speed. And then we're going to talk a lot about innovation and what the future looks like for technology in this space. But first, let's talk about how fast the company is growing. We've had an extraordinary 2022, and if you chance to look at our website, you'll see announcement after announcement after announcement of new contracts, new partnerships, and very rapid growth. During 2022, we announced 28 new contracts or extensions. That was over 200% growth off of 2021. Our most recent financials, which are about to be updated, we saw revenues growing at nearly 300%. Net losses coming down, cash flow positive is within sight. The partnership deals keep coming. And another theme you're going to hear a lot about at CloudDX is the concept of not only rapidly growing revenues, but also non-dilutive sources of cash, which is a big part of our story. But 2023 is even more extraordinary. Since January 1st of 2023, we've announced 8 new contracts, 7 contract extensions. So our growth is doubling. And already this year, we've announced roughly $1 million in contract value over the next 12 months. So on a run rate basis, it's really at that point in the hockey stick. And to be clear, our customers are business customers. Our customers are hospital systems, provincial governments in Canada, and large clinic groups and doctors' offices in the United States. What exactly is virtual care? What exactly is remote patient monitoring? And why is it such a big deal? Why is it so important? There are 3 parts to our platform. There's a part of our platform patients use at home to monitor their health, to monitor their vital signs. There's a part of our platform which is a portal that clinicians use in order to monitor patients remotely and improve their care. And then there's a whole suite of services and integrations that go around that drive efficiency in care, and that's the key. And we call that a virtual care platform. So, and this is pretty cool. Laser pointer here. There we go. There we go. This is the Connected Health Kit. There's an example of this kit in our booth, so please come downstairs and check it out. This is what patients use in their homes. It's designed to be extremely easy to use. There is the portal here for clinicians. The services is where we integrate with our partners. The kit itself has won awards. It has extremely high patient satisfaction, extremely high ease of use numbers. In fact, as high as you can get. In published peer-reviewed studies, we've shown 100% recommendation by patients and clinicians. All of this is protected by a robust IP portfolio. We have 12 patents, 9 of which were granted patents, 3 of which are licensed patents, and many patents pending. We continue to add to our IP portfolio. And the value propositions for this type of product and service are extraordinary. They cover the entire continuum of care. Patients love this type of care because, frankly, it's just better. You don't have to go to the doctor's office. You don't have to go to the hospital. You're receiving care in the comfort of your home, and that's a big deal for patients. We also have proven in studies that we can reduce pain after surgery. We can reduce medication errors. All of this leads to just a better experience, better outcomes. Providers love this type of care because it's more efficient. And in the United States, it's directly reimbursed. The reimbursers, the payers, that's the health insurance companies, Medicare, Medicaid, they see tremendous ROI, 30+% ROIs across the board, because this is driving efficiency. It allows the same amount of caregivers to care for more people and deliver better care and better outcomes. Our growth is not only in customers and not only in contracts and contract size, it's also in the scope of what we do. Since the beginning of the pandemic in 2020, we have gone from 2 use cases, which were chronic disease management use cases, now to 12 use cases in the hospital systems that we service. So more people are using our products, more people are using our services for more conditions. That growth has also been extraordinary. And the markets we address are enormous. 5 million Canadians and over 60 million Americans have one or more chronic illnesses. We've seen millions of deaths around the world for complications from surgeries. We directly address that point. And we've identified through our marketing 20,000 primary care clinics in the US who receive reimbursement for these services and can increase their billings and increase their ROI by adding remote monitoring to their practice and to their platform. Our partnerships are something we're going to dwell on in just a second. Being partners with Medtronic, which is the largest medical technology company in the world, and partners with Teladoc Health, which is the largest telehealth company in the world, gives us access to literally millions of patients through those distribution and reselling partnerships and integration partnerships. Access to patients is what drives reimbursement. And that is seen in both the contracts we've signed, the extensions we've signed, and the size of the contracts we've signed. This is a graph 21 versus estimates for 2022 versus projections for 2023. And as I've mentioned several times, growth has not only been extraordinary, but is accelerating. And that, of course, is what we want to see. Now, in addition to the care we're delivering now, using technology that we have invented ourselves or that we have purchased from others, we're also innovators. And these are 3 technology systems that we have invented and created and patented that are moving to market in the next 24 months. The one on the far left here is a revolutionary new type of blood pressure cuff that also measures respiration rate and cardiac symptoms and cardiac anomalies. This forms part of our relationship with Teladoc Health. Teladoc Health is very interested in delivering this through their networks of telehealth doctors, over 5,000 doctors across America. This device is a wearable device that monitors all the vital signs, including blood pressure, non-invasively and continuously. And this app on the far right here is extraordinary. This is an artificial intelligence application called AccuScreen. It's capable of diagnosing respiratory diseases based on analyzing people's cough sounds. All it is a smartphone app. You cough, it picks up the cough, analyzes that cough, and has demonstrated in valid clinical studies a very high accuracy for detecting respiratory illness. And these products are already on their way to market as they achieve regulatory approval. I mentioned earlier, PulseWave 2 is part of our relationship with Teladoc Health. Vitality, the wearable continuous monitor, already has a contract in place to service a 20,000 patient clinical study. And that's a mid-6-figure contract for this year. And AccuScreen cough analysis, competitors to that technology have achieved $100 million exits. In specifically, an Australian competitor had a similar technology and was sold to Pfizer for $121 million. Obviously, the value of that IP is currently not in our market cap. Let's get back to AI for a moment because AI is having a moment in the world, and this is a genuine generative AI application. When we record a cough sound, it's sent to the cloud, and an artificial intelligence platform is what identifies the respiratory disease behind that cough. This is technology that is similar in a lot of ways to the way that the giant large language models like ChatGPT generate the next words in a sentence based on analyzing millions and millions of data points. We are also analyzing eventually millions, currently hundreds of thousands of cough data points to generate that accuracy. In the clinical study we did in Mozambique for tuberculosis, we demonstrated 91% accuracy, which is greater than a chest x-ray. This technology is going to change the world. The immediate market for this is a $50 million market around the world for chest x-rays. That's the current screening tool for tuberculosis. This technology replaces the chest x-ray with a smartphone app. Further artificial intelligence technology is also in the pipeline. We're partners with Microsoft to use our system to deliver an AI-backed 3D augmented reality technology for use in clinics and hospitals around the world. This has received hundreds of thousands of dollars in non-dilutive funding to take it closer and closer to commercialization and is now ready for large-scale field trial. All of this innovation has been recognized by over a dozen prestigious awards. Now, awards are nice. It's nice to have an awards cabinet with lots of trophies in it. But what's important for investors about this slide is that a lot of these awards, not all of them, but many of them, come with non-dilutive funding, the largest of which was the Qualcomm Tricorder X Prize. The X Prize was a competition, if you Google X Prize, you'll see us, that allowed us to create much of our technology. X Prizes come up with multi-million-dollar prize purses for technology that doesn't exist yet. This technology was based on literally the TV show Star Trek, working Star Trek medical tricorder. We were one of 3 winners of that competition in 2017. And the grant money from that award is what funded the testing and trials in Mozambique for cough analysis. Other awards here come with literally millions of dollars in funding. Let's touch on the cap structure. The company is tightly held. 41% of issued and outstanding shares are owned by insiders. That percentage has increased since we became a public company in 2021, up from 34% to 41%. So board members and insiders continue to invest in our future, continue to invest in the technology. And that's the board. I just want to point out a couple of things on this board. We have 2 physicians on our board. That's pretty important. Having those physicians on our board gives us credibility with our clients and customers. These are physicians who have networks that help us grow both on the customer side and on the investor side. And so the key to that is how we funded the company even before we went public. As a private company, we did not raise any venture capital. We funded the company. Over $30 million was raised from over 300 individual doctors. That's a pretty unique story. We're very close to our clients. Bill Chernetsky is the director of one of the largest software companies in Canada, Point Click Care. And I want to point out Neil Fraser. Neil Fraser, until November, was the president of Medtronic Canada. He retired and immediately joined our board of directors. So the relationship we have with Medtronic is not only a technology relationship, it's not only a partnership in the growth of virtual care, but their former president is on our board. So once again, the 3 main differentiators for Cloud DX in the virtual care space. The first one is innovation. We are bringing patented technology to market that no one else has. That drives what we call compliance. And what that means is with the satisfaction scores we have that we've demonstrated, that we've published, we know and our customers know that the patients using Cloud DX are going to continue using Cloud DX. That's critical as a competitive advantage because compliance drives reimbursement in this space in the United States. And the third point, of course, is these partnerships. Our partnership with Medtronic includes a global distribution deal. We are integrating technology into our platform from Medtronic to be sold by both of us around the world in 2024. So why invest in Cloud DX? We're a company that's meeting real needs. 1 in 3 adults has a chronic disease. 1 in 6 adults has a neurological disorder. 29% of surgeries have a serious complication. That's a proven number in a clinical study. We have that clinical backup. We have the satisfaction rates. We are the largest provider of remote patient monitoring in Canada, and our growth in the US is increasing at triple-digit rates. We're the trusted partner of the largest and most successful technology companies in the space. We believe this is a revenue-generating and yet still blue sky opportunity because this technology is recession-proof. This space is recession-proof. It is inflation-proof. 10,000 people turn 65 every single day. Our market will never stop growing. So now I'm happy to take questions. And if you want me to dig into any of our specific technologies, please let me know. Great question. So from the point of view of competition, in Canada, we only really have 2 competitors. As I mentioned earlier, we're the market leader in Canada by far. We have the largest footprint. Entire provinces are our customers. Here's a fun trivia question. What do you think is the largest healthcare system in North America? Many people would say maybe Kaiser or Hospital Corporation of America. or the VA. But the truth is the largest healthcare system in North America is Alberta Health Services in Canada. The entire province of Alberta is covered by one system. It has over 40,000 doctors, over 600 hospitals. We are their sole exclusive provider of virtual care, the largest healthcare system in North America. So in Canada, our competition is minor. In the US, it's a much more complicated space. There are many, many, many small companies in the US that are providing something like this, but no giant. There is no 800-pound gorilla. There's no one big company that is dominating the space at all. It's too new. And by the way, the reimbursement codes that pay for this were not sponsored by a Philips, or they weren't sponsored by a giant company like Google or Alphabet. They were sponsored by the American Telemedicine Association, which is made up of many small companies. So although we have a lot of smaller competitors in the US, there is no dominant competitor. The market is essentially wide open. Sure. So there's two parts to that question. I'm going to answer it. That's a great question. Thanks, Gary. The first is, when your clients are government clients, it means you don't have to worry about AR. You don't have to worry about bad debt. We get paid net 30 on time. That's a big win for the company. We're not dealing with direct to consumer. We're not dealing with giant fickle partners like Walmart or Google or Amazon, which are very, very hard to work with as a small company. So that's a huge plus. We also receive many millions of dollars in non-dilutive funding through that government ecosystem. So that's an important point. On the US side, I mentioned earlier that we have identified, additional direction. We have identified over 20,000 clinics that fit the profile of a company, or a clinic rather, that can really generate additional revenue from reimbursed remote patient monitoring. So that means a clinic that has approximately 3,000 patients, anywhere from 1 to 10 physicians. This is a clinic that might gross $5 or $6 million a year and can earn an additional $1 million through deploying Cloud DX. We have a program we call Patient First, which is a unique program in our space that allows us to work directly with the clinic to ensure compliance and ensure the rapid onboarding of patients. So we've really cracked the code on how to grow in this space, and that triple-digit growth is continuing to accelerate on the US side as well. One more point, since Gary asked, and this is an important new market that's very exciting for us. Hospital at home. That's a new term that we're going to be hearing about for the rest of our lives. But the way that care is being delivered today, because of the pandemic, has changed. And now hundreds of hospitals across the US are taking advantage of a program called Hospital at Home. It was originally sponsored by Medicare. It's now also being supported by private insurance companies. It pays hospital systems the same amount of reimbursement to care for a patient, even though the patient is actually in their own home instead of in the hospital. If you think about that for a second, that's a huge savings. It means that hospital is not facing the real estate costs, the cost of feeding the patient, the cost of cleaning up, the janitorial, all the costs that go around with having a patient in the hospital, but they get paid the same amount. The additional ROI for hospitals in that world is over 38%. But it requires technology. And part of our relationship with Teladoc and part of our relationship with Medtronic is to rapidly grow in the hospital at home space. So these are areas where technology is changing quickly, but what we have going for us is our reputation for 100% satisfaction scores, our partnerships with the largest partners in the world, which allow us essentially to get at the table in almost any hospital system in North America, and yet the ability to iterate and to offer those integration services and to offer those customization services that a small, nimble company can do that our larger competitors just can't do. The large guys, they can't turn on a dime. They can't generate a new feature for anybody in less than 6 or 9 months. We're in a position to do that in weeks or quarters instead of months or years. Oh, sorry, Gary, there's a question at the back. So as we mentioned a few slides ago, we've gone from 2 use cases in 2020 to over 12 use cases today. But the primary use cases for remote patient monitor remain chronic disease management. And in that world, by the way, our technology is used by the patient literally for the rest of their lives. Our longest running programs started before the pandemic. Our patients have been on our system, the longest have been on our system for 6 years. We're only 8 years old. Those patients are now, in many cases, over 100 years old, but they're not going to the hospital because of their chronic illness. They're being cared for at home. Their satisfaction, of course, is 100% because they're still here. We really care about that. What gets us out of bed in the morning, folks, at CloudDX is the fact that thousands and thousands of patients rely on us every day for their care. But since the pandemic, we've seen tremendous growth in post-surgical monitoring, cardiac rehabilitation, pulmonary rehabilitation, including long COVID syndrome, and even palliative care. When you're talking to patients who are palliating with their patients who are looking at their end of life, having to, frankly, schlep your way down to the doctor's office every 30 days just for a wellness check, it's a huge burden. Giant health systems across Canada are using CloudDX now for palliative care, which makes a huge quality of life difference for both patients at home and their caregivers. So that's a huge win for everybody. Yeah, we have a slide about that. And let's go back to that slide. So again, just to be clear, whoops, we're in the wrong direction. Just to be clear here, we saw growth from 2021 to 2022 of 12 contracts to 28 contracts. So far in 2023, we've seen 15 contracts. That means we're on track for 60. I'm projecting 48, but we're actually accelerating. And so, when you're a public company, your financial statements and your revenue numbers are always 1 to 2 quarters behind. They're a trailing indicator of success. A leading indicator of success for CloudDX is contract signed and contract renewals. And frankly, contract renewals are just as important. Our growth is in both new clients coming on all the time and existing clients growing their footprint. New departments in the hospital using virtual care to care for more patients. We see over and over again, we see that our contracts are being extended. And frankly, when you're delivering care in an integrated healthcare system, you're very, very sticky. This is a huge advantage to CloudDX and to our business. Once we're deployed in patients' homes, once the clinicians are trained on our system, once we're integrated into the medical records of those patients, we're very challenging and expensive to pull out and replace with somebody else. So we see over and over again that our contracts are renewed. You get renewed because you're expensive to pull out, but you also get renewed because the customer loves you. So when you balance very sticky with 100% patient and client satisfaction scores, you know that we have a really strong moat around our business. We're almost out of time, but that's a great question to end on. And so the answer to that question is, perhaps we don't have anything to announce in that world, but we know that the more important we are to the delivery of care for giant partners like Medtronic and giant partners like Teladoc, the closer those partnerships are going to get. Whether that becomes global distribution, like we're already looking forward to with Medtronic, whether that becomes deeper partnerships, whether that becomes acquisitions, the good news is all of those options are open to CloudDX because we're delivering satisfaction, we're delivering value, and we're growing at triple-digit rates. And that's the key. Thank you very much, everybody.